I feel like I personally, everything I know that I use that is really actually useful for my practice, I learned after medical school. I mean, I learned the basics there, but I feel like everything I do, it like I had to seek this out. I had to go to the trainings. I see your continued thirst for staying as current as we can. It's funny, that just reminded me of, I saw there was I was a silly clickbait headline recently, but it was basically like, the question was, who is the more effective physician, younger docs or older docs in practice? It was just posed as this polar question. And
Yeah,
you open it, right? And they're like, well, doesn't matter. What matters is who sees the most patients and who stays the most up to date with what's going on in their fields and the fields around them. Right. And
totally.
it was like, so cool. You're kind of like, well, duh, guys. But
Of
thank you.
course.
Thank you for
Yeah.
doing that. Like
And there
that's,
is such a thing as wisdom. So old docs,
yeah,
gain wisdom and through experience and practice. And that's very important, but they also have to continue to have the drive to learn. And they have to be willing to change their
yeah,
models, their
yeah,
paradigm. And we're going to talk a lot about the concept of paradigm at a later date here.
yes, yes,
But that's something that gets very stuck. And that's if that older doc is not stuck in that and they're willing to sort of change their mindset and how they practice, how they see cases,
yeah,
yeah, so it doesn't necessarily matter. I get said, I'm too young all the time, of course. And some people prefer young doctors because they're more open-minded too. So it's
yeah.
lovely push and pull. The age doesn't matter necessarily. The level of experience can to some degree, but that has to do with the wisdom learned. But the attitude and the mindset is really what's most important. That's really what you have to evaluate from your practitioner, old, young, in between, male,
Agreed.
female,
Agreed.
anything.
And I I found personally, I think it's really important for patients to feel like they have a good relationship with me. That therapeutic value I'm specifically looking for. So if a patient doesn't really resonate with me, or we kind of don't really get along, which happens every now and then, I mean, it's not super frequent, but I have had folks where we just rubbed each other the wrong way.
Yeah.
I, in that alone, I was like, I think we should find other folks to work with, because there should be value here. I mean, we have the studies on it that patients do better when they feel that their provider is personally invested in their well-being. And
Yeah.
that's something I definitely see you bring to your folks. And I think it's one of those, it's not necessary for the doctor-physician relationship, but gosh darn, it goes so far in terms of
Yeah.
making that connection in which, we're able to encourage that healing to occur. So
Yeah, one of my instructors in Bastyr used to say to us every day, and this was even in first year, he'd say, "You are the medicine," and it's true. There's a certain amount of you that is the therapeutic has the therapeutic value of the whole process. It's not just you entirely, but it's you and them. It's kind of a collaboration,
it is,
and it's really quite powerful. And then most of these people are coming with immense amounts of accumulated trauma, not just like childhood trauma or ancestral
yes,
trauma and all these things, but medical trauma
yes,
especially. And you have to kind of be able to navigate through that to a degree. And part of that is that they will know if you care, if you're attentive, if it's really something that's important to you or not. I mean, people can see right through you at that point. So that's why I said it's another aspect. I think, or I personally believe, that you have to really want to do this type of medicine. And I've certainly had people that aren't a good fit too, and that's why collaboration with our colleagues is very important. Like
right,
like Lauren, like Dr. Mathewson here,
yeah,
and others. I mean, we're talking about a collaboration, and that's really going to be the theme of a lot of our discussions in this
yeah,
podcast going forward.
yeah, absolutely. I so agree.